So my background is that I'm a medical device entrepreneur, and I started a company about 6 years ago, 7 years ago, out of a grad school design class, and I ran that for 5 years with my co-founders, and we got it to a point where we'd sort of created the product, put it out there. We'd impacted about 150,000 lives with the product, and we'd put it across 7 countries, and I was looking to do, I was looking to sort of move on to do other things at the point, and the company was up and growing, and I was just sitting in my apartment in San Francisco one day thinking about what I could do next, and my wife's colleague actually mentioned about an interesting position that she'd read online, and it was purely out of chance that I happened to look across or come across this position online, and this sounded really interesting because it was this opportunity where it took me well out of my comfort zone. I like building things, and I like building physical things, and this position was not so much about building things or building physical things as it was about catalyzing innovation and trying to kickstart, shine a spotlight on an innovation effort and find ways to drive resources to drive the innovation effort towards growing it. And also it gave me an opportunity to sort of work with people outside of the traditional startup and the medical devices field, and work with the federal government, work on social impact issues. And I thought this sounded like a really interesting experience, and that that sort of would lead to interesting things, and that's how I ended up applying to the position. Just to come out and hang out here, I think it's just this place is so interesting because it sits at the intersection of so many different things that are happening within the government. So that's one huge part of, and it's a huge learning opportunity for anyone out there who's never worked in the federal government to come in and understand how the government works, what are some of the big, hairy, audacious goals that the healthcare system or the government has set itself to fix in healthcare, and what can you do to be a part of the problem-solving effort. I'd say the other interesting thing is that being an IR helps you sort of be a part of the government, but not necessarily be slowed down as much by bureaucratic processes. So you have a lot of latitude and flexibility in coming up with ideas and actually doing something about them relatively quickly, through the deep reach that the government has. But concurrently, what's really interesting about the IR position is that you have access to the resources and the industry expertise that an organization like West Health could bring to the table. And so when you marry the two, you've got a fantastic combination, which does not exist in many of these other innovation fellowship positions, if you look at it. So from that perspective, it's really unique.